Good morning, everyone, and welcome to today's presentation. I'm delighted to have you all here. Today, we will be discussing CAPA in pharma quality. My name is Dr. S.K. Singh, and I hold a Ph.D. in this field. Over the next few minutes, I will walk you through the key aspects of CAPA, corrective and preventive actions, and how they play a vital role in maintaining and improving pharmaceutical quality. We'll explore the fundamental concepts, best practices, and real-world applications. So let's get started. Let's take a closer look at what CAPA really means. It is a systematic approach, and that's key. It's designed to help us address issues effectively. When we talk about corrective action, we're focusing on eliminating the root cause of an existing problem. This is about fixing what's already happened to prevent it from happening again. On the other hand, preventive action is all about looking ahead. It involves identifying potential problems before they occur and taking steps to prevent them. This proactive approach is essential for maintaining high quality and compliance in our processes. You'll also notice that CAPA is referenced in several important regulations and guidelines, such as ICH Q10, which is the Pharmaceutical Quality System, the FDA 21 CFR 211, and EU GMP Chapter 1. These standards emphasize how vital CAPA is in ensuring product quality and patient safety. So, in essence, CAPA is about continuously improving our processes by fixing issues that exist and preventing future ones, making it a fundamental part of our quality management system. Let's talk about the importance of CAPA, or corrective and preventive actions. First and foremost, effective CAPA ensures patient safety, which is always our top priority. When issues are properly addressed, it helps prevent any harm to those relying on our products. It also plays a crucial role in maintaining product quality and data integrity, making sure everything we produce is consistent and reliable. This is vital for building trust with regulators and customers alike. Another key point is that CAPA helps prevent the recurrence of deviations. When we analyze what went wrong and implement the right corrective measures, we reduce the chances of the same issue happening again. Moreover, a strong CAPA process boosts our readiness for regulatory inspections. Being prepared and demonstrating a robust CAPA system can make a significant difference during audits. On the flip side, a weak CAPA process can lead to major audit observations, which can be costly and damage our credibility. So why is CAPA critical in the pharmaceutical industry? Because it directly impacts quality, compliance, and ultimately, patient safety. A well-structured CAPA system isn't just a regulatory requirement, it's a fundamental part of our commitment to excellence and continuous improvement. Now, let's take a closer look at the common inputs that can trigger a CAPA. These are the key pieces of information that help us identify areas where improvements are needed. First, we have deviations and nonconformances, which are essentially instances where processes or products don't meet specified requirements. Then, there are out-of-specification or out-of-trend results. These are laboratory or testing results that fall outside expected ranges, signaling potential issues. Audit findings, whether internal, external, or regulatory, also play a crucial role. They often uncover gaps or lapses in compliance. Complaints and recalls are important indicators as well. They reflect real-world issues that customers or regulators have identified. Lastly, trend analysis and risk assessments help us spot patterns over time, enabling proactive measures. It's important to remember that CAPAs must be driven by data, not opinions. Relying on objective information ensures that our corrective actions are effective and targeted. All these sources act as triggers, alerting us to problems that require investigation and correction. By understanding these inputs, we can better prioritize our efforts and improve our overall quality management system. Both approaches are essential for building robust quality systems. On this slide, we're comparing two key concepts, those based on root cause analysis and those based on risk and trends. When we focus on root cause, we're looking to fix existing issues. That's more of a reactive approach. It's about addressing problems after they've occurred, which is where corrective actions come into play. On the other hand, when we base our actions on risk and trends, we're aiming to prevent issues before they happen, which is a proactive strategy. Preventive actions are designed to identify potential risks early and mitigate them, helping us stay ahead of problems. The key difference here is that corrective actions are about fixing the problem once it's happened, while preventive actions are about preventing problems from occurring in the first place. This distinction is crucial because it highlights how both reactive and proactive strategies play vital roles in maintaining quality. By integrating both approaches, fixing issues and preventing future ones, we create more effective and resilient quality systems. This aligns with our overall goal of continuous improvement and risk management in our processes. Let's take a closer look at the heart of an effective CAPA. When it comes to root cause analysis, there are some popular tools that can really help us dig deeper. One is the 5 why analysis, which involves asking why repeatedly until we uncover the underlying cause. It's simple but powerful for identifying fundamental issues. Another is the fishbone, or Ishikawa diagram, which visually maps out all possible causes of a problem, helping us see the connections and root sources more clearly. Then there's failure mode and effects analysis, or FMEA, which systematically evaluates potential failure modes and their impacts, so we can prioritize our corrective actions. Now, it's important to remember that fixing symptoms alone doesn't solve the real problem. Just addressing the surface issue is like putting a Band-Aid on a deeper wound. Root cause analysis, or RCA, goes beyond that. It's about really understanding what caused the problem in the first place, so we can eliminate it completely. By leveraging these tools and focusing on true root causes, we ensure our CAPA efforts are effective and sustainable. That's how we make a real impact and prevent recurring issues. Let's walk through the typical CAPA flow in the pharmaceutical industry. First, it all begins with issue identification. This is where we detect and clearly define the problem that needs to be addressed. Next, we move into root cause analysis, which is critical for understanding the underlying reasons behind the issue, rather than just addressing the symptoms. Once we know the root cause, we proceed to CAPA planning, where we develop a detailed plan to correct and prevent the problem from recurring. After planning, we focus on implementation, putting our corrective and preventive actions into effect. Then, we conduct an effectiveness check to ensure that the actions taken have successfully resolved the issue and prevented future occurrences. Finally, we close the CAPA and document everything thoroughly. It's essential that all documentation is traceable and auditable, especially in pharma, because it supports compliance and continuous improvement. This CAPA lifecycle is fundamental to maintaining quality, safety, and compliance throughout the pharmaceutical manufacturing process. Now, let's focus on the regulatory expectations around CAPA effectiveness. It's crucial to verify that the corrective and preventive actions we implement actually work. We can't just assume they've resolved the issue. We need to confirm their effectiveness. After implementing CAPA, we should monitor trends over time to see if the problem truly stays resolved. This means tracking data post-implementation to catch any signs of recurrence early. Using measurable indicators, like KPIs, is key here. These metrics help us objectively assess whether our CAPA is effective or if adjustments are needed. The FDA often emphasizes this point, frequently citing cases where CAPAs were closed prematurely or ineffectively. That's why, when conducting a CAPA effectiveness check, thorough validation is essential. In essence, a robust CAPA process isn't just about fixing issues. It's about ensuring those fixes hold up over time through diligent monitoring and measurable success criteria. Now, let's take a look at some common observations that inspectors often make during their reviews. One key issue is inadequate root cause analysis. When the root cause isn't thoroughly identified, the corrective actions may only be temporary, leading to recurring problems. Another frequent observation is repetitive deviations. This indicates that previous issues haven't been effectively resolved, and the same problems keep coming back. It's a clear sign that the corrective actions need to be more robust. Poor documentation is also a common concern. If actions, investigations, or decisions aren't properly documented, it becomes difficult to verify that appropriate steps were taken, and it raises questions about compliance and accountability. We also see instances where no effectiveness verification is performed after implementing CAPAs. Without verifying that the corrective actions actually work, we can't be confident that the issues are truly resolved. Additionally, sometimes CAPA is closed out without sufficient evidence. This means closing the case prematurely without confirming that the problem has been effectively addressed. All of these issues highlight a recurring theme: relying on quick fixes. These quick fixes might seem easier at the moment, but they often lead to repeat observations and unresolved problems in the long run. So, understanding these common CAPA failures helps us see where we need to improve our processes and ensure that we're truly addressing the root causes, not just the symptoms. This slide doesn't contain enough information. That's why we're moving to the next slide. Building a strong CAPA system is really about cultivating a culture, not just filling out a form. It's about fostering an environment where continuous improvement is part of our everyday mindset. When we approach CAPA this way, it becomes a proactive process rather than a reactive one. Focusing on root cause analysis is crucial. It's about digging deep to understand what truly caused the issue, rather than pointing fingers or assigning blame. This approach helps us implement effective solutions that prevent recurrence. Connecting CAPA with risk management and trending is also vital. By integrating these areas, we can identify patterns early and address potential issues before they escalate. It's a more strategic, holistic way to maintain quality and compliance. Remember, a strong CAPA system directly supports strong GMP compliance. When our CAPA processes are robust, our overall quality standards are elevated. Ultimately, quality excellence begins with an effective CAPA. It's the foundation that ensures we continuously improve and meet the highest standards. So keep these key points in mind. Cultivate the culture, focus on root causes, link with risk management, and remember that a solid CAPA system is essential for overall quality success. For further support, please contact us. We're here to help you with any questions or additional assistance you might need. Feel free to reach out through the contact information provided. Thank you so much for your time and attention today. We appreciate your engagement and look forward to supporting you moving forward.